everyone, I am Jamie Lynn Becaco, your student nurse. For today's video, I'll perform a return demonstration to assess the peripheral vascular system. But before we hop onto that video, let me show you what equipment we'll need for today's assessment. So without further ado, let's get started. So before performing this procedure, we have to perform proper hand hygiene and don our PPE if necessary. After that, we can now proceed to the assessment. Good day, sir. I am Jamie, your student nurse from Our Lady of Fatima University. So, sir, for verification, can I ask what is your name?
Cedric J. Tubat.
And when is your birthday?
November 4, 2002.
How about your age, sir?
I'm 20 years old.
So that is the first thing that we need to do. We have to identify our patient for us to ensure that it is the right patient in front of us. If there are any curtains or any doors in the room, we have to close them as well in order to provide privacy. Then after that, we have to explain the procedure to the patient. Okay, sir, I'm here to perform an assessment on your peripheral vascular system, and for me to be able to assess those parts, I will need to touch certain parts of your body. Is that okay with you, sir?
Yes.
Alright, rest assured, sir, that all of the documents are completely confidential between the attending physician and me. So, do you have any questions, sir, before we start?
None.
Okay, but if you have questions later during the assessment, don't hesitate to ask me.
Okay.
Okay, sir, since I already explained the procedure to you and I'm handling this patient count, so you can change with this one. So I already told the patient to change into the patient count. I already performed hand hygiene and provide privacy for the patient. And now I'll be starting to perform and assess the upper extremities of the patient. So the first thing that I'll be needing to do is to inspect for the skin color, and I'm also touching the back of my hands to check temperature down to fingertips. So your skin is warm, the color is appropriate for ethnicity, and I don't see any pallor or cyanosis. And I'm also looking at your arms for any lesions or anything abnormal, which I do not see. And then as I move down the hand, I'm also looking at your fingertips. I'm checking for a capillary refill by pressing on each of the nails on both hands. And the fingernails are pink. And then as I move down the hand, I'm also looking at your fingertips. I'm checking for a capillary refill by pressing on each of the nails on both hands. And the fingernails are pink, which is normal. I also checked the profile sign, which I'm looking at right here. The angle here should be less than 160 degrees. And so I see that the profile sign is 160 degrees, which would be normal. So then I'm going back to check your pulse. I'm going to start by checking your radial pulse. So as I am checking the pulses, I'm checking them at the same time so I can see if they are symmetrical. The strength normal is 2+, and I'm also checking the rhythm. It should be regular, and the rate should be within normal limits. And then I'm going to move on to the brachial pulses, and here again, I'm checking for strength. The rhythm is regular, and the rate is within normal limits. Okay, so we are now done assessing the upper extremities of the patient. Let's move on to the lower extremities. So I'm going to look down at your legs and put your legs up. If you want to lay back, that's totally fine. So I'm looking at the lower extremities. First, looking at the color, which is appropriate for ethnicity. I'm looking at hair distribution, and the reason for that is when there's poor circulation, sometimes then there's no hair on the lower extremities anymore. And I'm also looking at the lower extremities for any lesions or anything abnormal. I'm also going to touch the lower extremities, first for temperature. I use the back of my hands and come all the way down to the toes, and his skin is more all the way down to the toes, and I've checked for any abnormalities. I'm also checking and looking if there are any venous patterns, or particularly the back of the leg is where you would look for any varicose veins, which I do not see. Alright, and then I'm going to look at the toes. I'm looking at the color, looking at the nail bed, it should be pink, and I'm also checking for capillary refill. And capillary refill should be less than 2 seconds according to some authors, less than 3 according to other authors, and you can document it as less than 2 seconds or less than 3 seconds, or if it's very fast, you could document capillary refill as brisk. Next, I'm going to check the pulses on the feet, and these are the dorsalis pedis pulses right on the top of the foot, and you want to check the strength. Normal would be 2+, the rhythm should be regular, and the rate would be within normal limits. Now, the way you find this pulse, there are a couple of different ways you can. You can just start here, between the first and second toe, and move straight up. And I like to find these bones that's right here, and then just move laterally or towards the outside to find that. He has nice, strong pulses, so they're easy to find. For many elderly patients, it's very difficult to find their pineal pulses, in which case you would get a Doppler to try to find those pulses. And you look at the other assessment findings to see if there is a good circulation to the toes, like the color, the temperature, and the capillary refill. So next, I'm gonna check the post-tibial pulse. So here's the malleolus, right here, that bone, and you want to slide your fingers right here. There's almost like a notch there, and that's where you're going to find that pulse. And this one sometimes can be a little bit harder to find. You might see this one sometimes can be a little bit harder to find. You might see you have to move your fingers around a little bit, or sometimes you have to put your fingers in there and sort or even press up towards that bone. So you would check both of this, okay? And if you can find them and do that at the same time, so you can check symmetry, that would be good. And again, you're checking the strength. This is 2+, it's normal. The rate is within normal limits, and the rhythm is regular. Okay, good. So that's all for the assessment, sir. Thank you so much for your cooperation, and have a nice day. So I will ask my patient to change his patient gown into his clothes, and I'll be performing proper hand hygiene. Also, if there are any signs of abnormalities, we want to refer them to other healthcare provider for further evaluation. After that, we are now done with the assessment.